Hello everyone, this is Miss Gibson. So this is lecture 3 with the immune system. This is care of the patient with an infection. This is also chapter 16 in your Med Surg book. So first are just some definitions that you guys need to make sure that you know. They can be found in your textbook, so make sure you look those up. So now we're just going to kind of do an overview of transmission of infectious agents. Transmission requires 3 factors. Your reservoir, which is a source of infectious agent, can be people, animal, insects, can be water, soil, surfaces, or a carrier harbors an infectious agent without the active disease. A susceptible host with portal of entry. The immunity status determines the susceptibility of the host. So a portal of entry, some examples of that would be broken skin, respiratory tract, such as a ventilator assisted or ventilator associated pneumonia. Your GI tract, example of that would be salmonella. GU tract, which would be your caudis, or the bloodstream, such as catheter acquired bacteremia. Then you also have mode of transportation. My goodness. Mode of transmission. You have contact transmission, which would be direct contact. The source and host have physical contact, like person to person. Indirect contact would be transfer of agent from one source to a host by passive transfer, such as by touching a stethoscope that someone else has touched. Then you have droplet, which is contact made with infected secretions or droplets, such as the COVID-19 or influenza. And then you have airborne. This is small airborne particles leave source and enter susceptible host, may be suspended in air for prolonged time, requires special air handling and ventilation. And then you also have environmental, such as contaminated food, water, or vectors, such as Lyme disease. Physiological defenses for infection, you have body tissues, phagocytosis, which is where the neutrophils engulf, ingest, kill, and dispose of antigens. Inflammation, which is a non-specific defense, and then of course your immune system. This is antibody-mediated immunity response and cell-mediated response, which would be through your T lymphocytes. So your stages of infection, you have your incubation period. This is where the pathogen begins active replication but does not cause symptoms. Could last hours to years. Prodromal stage, which is symptoms first begin, often nonspecific. The acute phase, the pathogen disseminates rapidly, and you end up with signs and symptoms such as fever or chills. Or chills, actually. Methods of infection control and prevention. Of course, you have hand hygiene, sterilization and disinfection, standard precautions, and then your transmission-based precautions. Infection control in healthcare settings. You have your healthcare associated infections, which are acquired in a healthcare facility. These can become these can come from patient's flora, or they can come from exogenous, which would be outside of the patient's body. For whatever reason, I cannot talk today. Please forgive me. Infection prevention and control inside the healthcare facility is designed to reduce the risk of healthcare associated infections, thus decreasing morbidity. The Joint Commission is that is all recommended by the Joint Commission National Patient Safety Goals in an effort to create a culture of safety, which I'm sure you will hear about if you work in a healthcare facility at all. Infection control programs role. The CDC recommends one certified infection control clinician for every 100 beds in acute care, one to oversee in long-term care. Let's see, methods of infection control and prevention. You have hand hygiene. You have sterilization, which destroys all living organisms and spores. This is your sterile technique. You have decontamination, which decreases level of disease-causing organisms. You have standard precautions. This is PPE usage. Then you have transmission-based precautions, which refers to airborne, droplet, as well as contact. The CDC also recommends staff and patient placement and cohorting. Full-time routine staff leads to consistent practice. Placement, private room if airborne precautions, also droplet and contact if possible. If no private rooms are available, then cohort, same colonized or same infection. Accurate handoff between units is very important, and then protection of visitors of patient with transmission-based precautions. Visitors are seldom monitored for compliance. I think that got just a little bit better. It improved with COVID-19, but I have seen now that we've backed off of that a little bit, but that is a very important step. Multi-drug resistant organism infection, you have MRSA, VRE, and CRE. With your multi-drug resistant organisms, these are drugs that were once useful but no longer control the infectious product, the infectious agent. New antibiotics can't keep up with preventing antimicrobial resistant infection, thus increases patient mortality and morbidity. You also have colonized, which is microorganism is present, but no infection is present. It can become an infection though. And then biofilm, this is a group of organisms that function within the slimy gel coating on medical devices, usually seen on urinary catheters, orthopedic implants, feeding tubes, chronic wounds, also plaque on teeth. So all of those go into account for the multi-drug resistant organisms. Now we're going to talk about each of those. The first one is your MRSA. This is a common bacteria found on the skin, perineum, and of course in the nose. Good hygiene controls growth and controls growth and not infectious. When non-tact skin comes into contact with the infection, it does develop boils. When it enters deep wounds, surgical incisions, lungs, bloodstream, it can cause serious or systematic infection. Within the past 40 years, no longer responding to methicillin or penicillin drugs. One of the most common and fastest growing in healthcare facilities today is the MRSA. MRSA pneumonia, abscesses, bacteremia can quickly progress to sepsis. Susceptible to only a few antibiotics such as Vanc, Zavox, or cephalosporins approved for MRSA. Bathing in 2% chlorhexidine gluconate solution decreases risk by 23 to 32%. You will see that done a lot for patients coming into places like the unit. Community acquired associated MRSA causes infections in healthy, non-hospitalized individuals, especially college campuses, prisons, crowded living areas like long-term care areas is easily transmitted. Next, we're going to talk about vancomycin resistant enterococcus, or VRE. This is bacteria that live in the intestinal tract. It's important for digestion. Bacteria move to another area, such as this same bacteria. If it moves to another site, such as a surgical procedure, it can cause prolonged hospital stay, severe illness, abdominal pain. They will be put into contact precautions. MRSA will also need to be in contact precautions. And it can live on a surface for days to weeks. Traditionally was treated with vancomycin, but resistance has developed in recent years. Prolonged length of stay of the hospital, severe illness, abdominal surgery, and enteral nutrition are all at increased risk for this. Next, we're going to talk about CRE. This is an antibiotic often given for abdominal infections such as peritonitis. Klebsiella and E. coli are commonly found in the GI tract. They're difficult to treat as their enzymes break down the antibiotics. So high risk would be in the units, long-term care, and then of course your immunosuppressed, patients. They will be in contact precautions. The CDC also recommends chlorhexidine baths to prevent spread and to decrease colonization of this as well. So OSHA, which is our Occupational Safety and Health Administration, it's a federal agency that protects workers from injury and illness. The law, this can lead to fines as well as disciplinary actions. They want staff to be vaccinated against Hep B and C. They want to make sure that there is PPE present, where that we're limiting the exposure. They push for the flu vaccine as well. Some other things that you might see that workers might come into contact with is animal transmitted infections, the hantavirus. This is excrement from mice or rats. You want to make sure you wear gloves or mask when cleaning rodent infested areas to prevent this hantavirus pulmonary syndrome, a rare but severe, potentially fatal respiratory disease. I've not heard of that a whole lot, but the book talked about it, so we added it. Results of, let me move this down. Results of inadequate antimicrobial therapy. Problems resulting from inadequate antimicrobial therapy can range from a variety of issues: non-compliance, which is deliberate failure to take the medicine; non-adherence, which is accidental failure to take the medicine; incorrect medication or inadequate dosing can contribute to MDRO, which is the multi-drug resistant organisms. Local infection is inadequately treated or misdiagnosed, thus not treated correctly, can lead to abscess and systematic spread, which would be sepsis. Sepsis is the number one cause of hospitalized death. Severe life-threatening cases of leukopenia develops, as well as DIC. So it's really important that you do good patient education on following antibiotic directions. You know, you see a lot if your patient feels better, they may only take 3 or 4 days worth of their antibiotics, but it's been ordered for 7 days. That kind of thing is very important. That education is very important for your patients. With your nursing care, you're going to do a good head to toe assessment. You're also going to assess for any vaccination status, any recent exposures. Labs, you're probably going to see a CNS ordered, white blood cell with diff, an ESR to test for inflammation, as well as your imaging might be ordered there depending on what the patient has going on. Nursing management, patient problem, just an example, fever due to immune response triggered by a pathogen. Your goal, body temperature will be within normal limits. Intervention would be antibiotics, antivirals, or antifungals. You're going to do that good patient education. You may have to give an antipyretic if they're having fevers, or fluid replacement. So now we're just going to go through a brief overview of emerging infections or bioterrorism. Emerging infections, remember, strict infection control measures prevent the spread of microbes even when dealing with bioterrorism. An epidemic is an outbreak of disease that spreads quickly and affects many individuals at the same time. COVID is a good example of that. A pandemic is a type of epidemic, one with greater range and coverage, an outbreak of a disease that occurs over a wide geographic area and affects an exceptionally high proportion of the population. So the coronavirus was actually a pandemic, Spanish flu in the early 1900s, and then in 2014 it was an epidemic of Ebola. West Africa was largest known in history for Ebola. An American traveler was diagnosed and hospitalized in Texas and later died. Signs and symptoms would be fever greater than 101, severe headache, muscle pain, weakness, diarrhea, abdominal pain, and unexplained hemorrhage. It's spread through body fluid exposure or needle stick. Recovery is based on appropriate care and person's immune response. Those who recovered developed antibodies that can last up to 10 years. The Spanish flu, millions were killed worldwide. Healthcare workers are encouraged to take the influenza vaccine annually. Foodborne infections are on the uprise in the United States. Spinach, ground beef, lettuce found to be contaminated with E. coli and other pathogens. Chipotle and other food chains have been associated with GI infections for many customers. Safer food prep practices and monitoring by federal agencies have met the public demand, but more oversight is still needed. Clostridium difficile associated disease, or C. diff. This is associated with antibiotic use, especially older or immunocompromised patients, has led to new diagnoses. And then your bioterrorism, this has been a major focus in government since 9/11. Smallpox is a risk, not is only a risk not if you don't get vaccinated. Those who have been vaccinated are years ago, thus may be weakened. Anthrax is spread through skin contact or inhaled. Fatality rate is high in humans. The U.S. government is currently working on vaccines for many bioterrorism agents and stockpiling for availability. So these are just some key terms that you need to know for your testing purposes. All the definitions and information you need for these key terms will be in your chapter 16 and 17. We have some practice questions. This stage, the symptoms first begin and are often non-specific. The next question. So, Mr. L, a 65-year-old who has an indwelling urinary catheter in place. The catheter provides a portal of entry. Alcohol-based hand rubs are not appropriate if one's hands are visibly soiled or feel sticky, or if you have just toileted. In these cases, wash your hands instead of using alcohol-based hand sanitizer. It's also ineffective against spore-forming organisms such as C. diff. The patient's immune status plays a large role in determining risk for infection. Congenital abnormalities, acquired health problems, for example, kidney injury, steroid dependence, cancer, or AIDS, in advancing age can increase a patient's risk for developing immunologic defenses. Chronic physical and psychological stress can also depress the immune system, making the patient more susceptible to infection. Urinary tract infections is one of the most common healthcare acquired infections. More than half of patients in adult intensive care units have urinary catheters in place. I do know that a lot of hospitals have started removing them as soon as possible to decrease their CAUTI numbers. In American hospitals alone, the Centers for Disease Control estimates that healthcare associated infections account for an estimated 1.7 million infections, 99,000 associated deaths each year. It's of these infections, 32% of all healthcare associated infections, healthcare acquired, I'm sorry, were CAUTIs. Kind of scary stuff. So the patient should be admitted to a private room under contact isolation. The patient should be taught to perform frequent hand washing. Healthcare personnel and visitors should wear gloves upon entering the room to prevent contact with the patient, contaminated items, or uncontrolled body fluids. Hand washing should be performed before leaving the room. There should also be dedicated equipment for the patient to prevent the spread of infection. A mask should be worn with airborne or droplet precautions. The door should be kept closed with airborne precautions, not contact precautions. MRSA is susceptible to only a few antibiotics such as Vanc and Zyvox, as well as cephalosporins. MRSA is spread by direct contact, such as with indwelling catheters, vascular access devices, and endotracheal tubes in the hospital and community settings. So that is all for lecture 3 of the immune system. If you have any questions, please make sure to give me an email. Make sure that you're looking over your extra resources as well. Thank you.